Wow, it's been a long time since I've sat in front of camera like this. I was actually looking at when I posted my last YouTube video and I thought it was a year ago, but it was actually 2 years ago, which is insane considering just how quickly time's gone by. Um, I've had a couple of friends and other people asking me if I was going to post any new videos or continue with my YouTube channel, and then I just kept making the joke that, I retired because I only wanted to post something if it really brought value to the people who are watching it. I mean, just going back to why I even started this channel in the first place, it was because I saw so much differential access when it came to information regarding pre-medicine or even the med curriculum itself. Either you had to pay to get information to support your studies or just information regarding the process itself, or it was up to like the connections you had and the people you were friends with. And so I just thought, why not put all the information I know, having gone through the process itself, onto a platform that everyone has access to and everyone can see it for free. So that's why I haven't really posted much, because I mean, you can do as many vlogs as you want, but how much value am I really bringing with that? And also there's not much I can actually film in the hospital itself. But I'm still super grateful for all the people who have reached out. I still get lots of emails and lots of messages on Instagram saying how grateful everyone is for the videos that I posted and asking for advice and help and support. I'm glad that my videos are making things at least 1% easier for the people out there who are watching it. And then I was just thinking over the holidays, maybe it's time to revive the channel or post something. And I thought about the fourth year OSCEs that everyone kind of gets a bit confused and worried about at the beginning of the year, just because no one really tells you what's about. Even the university doesn't. And you kind of just have to go and talk to all the seniors in the year to get an idea and feel about what comes up. So yeah, I thought it would be a good video to come back with, and I guess let's just get straight into it. So the OSCEs are run over 4 days and it's split between Grafton and Middlemore Hospital. There are 6 stations in total and each station is about 10 minutes long with 2 minutes of pre-reading time before you enter the room. And out of the 6 stations, 3 are going to be medical and then 3 are going to be surgical. Out of the surgical stations, 1 is going to be history, 1 is going to be emergency station, and then 1 is going to be an exam. And then in the medical stations, 1 is going to be a Maori history, 1 is going to be an exam, and the other one is also an exam. So you actually, in the 10 minutes, have 7 minutes to do the history or the exam, and then there's going to be this bell that goes off, and you should be prepared to either summarize that history or summarize the findings of your exam and present it back to the examiner. And then the last 3 minutes is where the examiner asks you a couple of questions. So it's just a Q&A session, really. The actors, so the people who come in, the patients, are actually actors. So they'll try and act out a pathology. If they can't act it out, then there will be images to help you. And some people don't really finish their history exam in the 7 minutes. Honestly, I can't make a comment as to whether that affects your grade or not. But honestly, just try to do everything you can within those 7 minutes. Just to start with some general advice, when should I start preparing for OSCEs? So based on what I heard from some 5th years, I started about a month before the OSCEs. It's just so I could ease my way into it. Sure, there are people, maybe your friends are going to be I'm going to cram it in the last 2 weeks. And it's doable, but they might also be the people who walk out of that room hoping that they passed. If you want to walk out of those rooms knowing that you're 100% passed, then prep early. You can't go wrong with it. You want to go in that room and be able to perform those exams flawlessly, as if it's just pure muscle memory. And even when you've prepared it for a month in advance, you will still, in that room under the pressure and adrenaline, get nervous and forget some stuff. And that's completely natural, but it's to try and mitigate how much you will forget in that moment that you want to start preparing early on. Throughout the clinical years, you will do a couple of these things called mini CXs, which is kind of a mini OSCE really. So you take a history, you do an exam, and then at the end you're going to present those findings and have a discussion with the consultant what you think the diagnosis is and investigations and all that. So don't take these lightly. Take the feedback seriously, as it's a good stepping stone to build on for how you're going to perform at the OSCEs. some hospitals in Auckland, I know North Shore does this, they actually run MOSCEs, so mock OSCEs, at the end of Gen Surg and Gen Med, which is actually really nice. But unfortunately, I was a Middlemore. I mean, not unfortunately, I actually love Middlemore so much, but Middlemore did not have that. It's just an extra thing that you can prepare with, but it's fine. You'll survive. Another common question that a lot of people ask is, should I be like presenting my findings out loud while I'm doing the exam? I would say go for it, just do it. Like, if they don't want you to do it, they'll tell you to shut up, so just do it. And I think the benefit of doing it is you also remember what you want to present or what the key findings are, which acts in your favor as well. So, that was my mouse. Okay, so let's break it into surgical and medical stations. Starting off with history. So there's a lot of potential cases that you can get, but you aren't just limited to these ones. I'll list the ones up here, but don't attack me if something new shows up, okay? If you're watching this at the beginning of the year, don't stress, guys, honestly. Like, after you've done your surgical rotation, you'll have gone through many of these cases and you'll be familiar with them. But make sure that with each one, you do become confident in like the pathophysiology, signs and symptoms, investigations, treatment, and differentials. Those are like the key branches that you should know. What else? So the history aspect of it is kind of like the basic stuff you've been exposed to since second year. So, you know, if it's pain, Socrates, go through your history of presenting complaint, allergies, medications, social history, past medical history, family history. I'm sure you guys are like experts at that by now. But by year 4, you should be able to take a really good history and to also fine-tune it down to what your differentials are. Just don't forget to do a quick systems review at the end, and also to mention any red flags and rule those out. So the case that I got was appendicitis. It was pretty obvious from the get-go, but obviously I still had to like cover all my bases so that I could rule out other differentials. And then the questions I got were once again to do with my differentials, and then they asked what kind of investigations that I would do, and management as well. I'm kind of low-key reading off a script, which is why I have wandering eyes, because who's gonna memorize the script, right? Alright, next one, emergency station. So this is the station which technically you gotta self-learn to a certain degree. You can just use Geeky Medics. In essence, it's basically like the doctor's ABCD, and it's slightly touched on in the anesthetics run, so pay attention there. But it's not to the depth that we need it for the emergency station. So yeah, Geeky Medics is your go-to. Obviously, I'm not going to reiterate every single thing that is on that website. Just go read it. But I can tell you that the most common topics, which is not limited to these ones, okay guys, it was post-op sepsis. So know your signs of sepsis and also sepsis, blah, blah, blah. Know your signs of sepsis and sepsis 6 management. Post-op hypervolemia was another one, so know your signs of shock, the different types of shock as well. There was motor vehicle accident, I got that one. So be familiar with like what the seatbelt sign is and what that means and what you would do about it. And then anaphylaxis could be a potential as well, so adrenaline, guys, know your dose as well. One thing that most people found a bit confusing is, when do you call for help? And I had heard so many different like things about this that I went into the station and I completely forgot to even call for help. It was fine though, because my examiner was very sweet, and he kind of like prodded me towards that. But I would say you can ask if you have assistance from the get-go, because you know you're just generally curious, right? And then they might say, no, you're the only person here. So then have a look at the vitals, and if you can tell that the vitals are off, which they obviously will be because it's the emergency station, that's when you kind of call for help. But yeah, just don't forget it like I did. Now moving on to the last one, which is the exam station. There's a list of exams that they can ask you to do. I will list them here. One thing that was asked a lot was also, do we need to know all the ortho exams? Yeah, just learn them, guys. They didn't ask us any in my year, which was surprising and a shock, but that doesn't mean that they won't in the upcoming years, and I know that they have. So they are they are a bit of a pain to learn. Thankfully, I had orthopedics as my last rotation, so it was fresh in my memory, and I legit just asked my registrars and consultants to have a look at them. But if you have orthopedics as your first rotation, yeah, that sucks, guys. But just learn it. You kind of want to have a good system towards it, and it's a pretty straightforward system as well. It's kind of just look, feel, move. Then you have your special tests, and then you have like your neurovascular integrity. So kind of use that as something you can always fall back on. And as I said, like, get your ortho regist to have a look at them, because they kind of don't teach you these exams in med school, kind of have to self-learn it, which is so much fun. I got peripheral vascular disease. They started by showing me a leg with PVD, and then they were like, oh, describe the image that you see. So it was kind of straightforward. And then they had a patient, actor, who obviously didn't have PVD, but they were like, do a PVD exam on them. So I just kind of went through the systematic way of doing that. I think they were more so looking at if you know where the pulses were. So knowing your anatomical landmarks to feel for those pulses. In terms of like the questions, they asked me about ABPI and what it is and how would I calculate it. And then they gave me this image with like different ABPI at different points in the lower limb. And then they were like, oh, where's the block? So you had to mention where or which artery the block was in. And then they just asked for investigations as well. Okay, so medical stations. So the history one is going to be a Hawara Maori one. So it's with a Maori patient and you're kind of being assessed on your ability to integrate the hui process. And if this sounds unfamiliar to you, that's fine, guys, because this is something you learn in fourth year itself. There are 4 parts to it, and most people found it hard to even finish the history. But definitely try and cover your history of presenting complaint, obviously, because that's why they're there. And touch on other stuff like past medical history. If you do get to social history, then make sure you take a good one. The thing that you want to do is if they're using Maori words in the conversation and you don't know what they mean, then be honest about it and ask them what does it mean. Don't just go on and continue taking the history having no idea what they just said. This is showing like a willingness to learn about their language. And even better is if you reflect that back as well. So if they use specific words, then use those words while you're talking to them. One of the questions that I got, I think it's quite common as well, was what are the barriers that Maori face when it comes to healthcare? So have a think about that. So next is the 2 exam stations. So there is once again a list of exams that they can make you do, and I will list over here. I got Parkinson's and a rheumatology hand exam. The Parkinson's one was pretty obvious from the get-go as well. And they were very straightforward. The rheumatology one was I had to do the exam and then they showed me like a couple of pictures and they were like, oh, describe what you see and present it back. So that was also pretty straightforward. One thing I'd say is don't sleep on rheumatology because they don't really teach you it. Unless you do rheumatology in SpecMed, you have like one session where you get taught these exams and you want to make sure you know them well. Once again, have a good structure to fall back on. For hands, I just go distal to proximal. So start with the nails, nail changes, then go to your DIPs, PIPs, MCPs, wrists, elbows, like that. It's pretty easy if you think about it that way. And another thing for medical exams, like cardiology comes up quite frequently. So murmurs, guys. I did cardiology as my spec med, so murmurs was very straightforward and comes pretty easily to me. But if you didn't do cardiology, then this is something that you want to get a good grip on. Go and listen to as many murmurs as you can, if you have the ability to. The most common murmurs are AS, MR, so aortic stenosis, mitral regurgitation, and probably aortic regurgitation would be the 3 most common. But like, know the other murmurs, know the diastolic from the systolic ones, know other features of murmurs like, oh, where do they radiate to, where is it heard loudest, what maneuvers can you do to make them louder? Is a heard louder on expiration versus inspiration? All the other stuff. Like, it's on YouTube, just watch YouTube videos about it. I'll put the previous year's topics in like the description box below or something, so you can have a look as to what came up in the past like 2-3 years. I got these from my friends, so I just kind of collated all of them together. But I cannot emphasize this point. Like, honestly, it's not limited to these ones. Like, something else random could show up, and make sure you're prepared for that as well. So the next thing that I wanted to talk about was resources that I used. Obviously, practice in groups. So 2 is good, 3 is even better, because you have one person who's kind of like checking if you're doing everything well. Also, a good thing is to practice on someone who has no prior medical knowledge. So family members, like, the best way to know if you're communicating something well is to do it on your family members or your siblings, because they have no idea what the exam entails. So then do it on them and see if they can actually, understand your instructions, especially for like cranial nerves and neuro exams where you kind of have to do a lot in those ones. OSCE Sense was a good online resource. There is a paid version as well, but honestly, you don't need it. Just use the free ones, guys. It's where you can kind of get into, again, groups of 2 or 3, and it gives you like an amazing rundown of the emergency station, history, and exam stations. And there's like a marking sheet that I would say, and the third person can kind of go through the marking sheet and tick off things that you're doing well. And there's also like the investigations that you would get, and so you can interpret those, and then they ask you about management and stuff. So it's really good resource, and it's the perfect way to get into the OSCE environment and make sure that you're ticking everything off and also communicating things well. Another thing that I used was the Yakima folder. So this is something that was sent to me by a friend. I don't even know if everyone had access to it. I hope everyone did, because I don't know, it's kind of something that you just get from asking people, really, once again, which is why I'm going to put it in the comments so everyone has access to it. It has basically a whole bunch of resources. The most important one, I would say, is the Essential Examinations booklet. So that has an amazing, very detailed rundown of every single exam. There are some exams that you don't need to know that are in there. You'll know which ones they are. But key thing, you don't need to know every single word on that booklet. Okay, so by the end of 4th year, you'll kind of have a good understanding of what are the key signs and what kind of pathology or diseases they represent. So just learn the main ones. You don't need to know every single one. Another thing I like to do is I had a tracker system. So I just made this really simple table, and I put down all the exams that I need to know. And then I would do the exams on certain days, and I would record which days that I did those exams. So it's kind of like, spaced repetition. Like, I've done this 2 days this week. Maybe we'll give it a break, and I can see which exams I haven't done in a while and then practice more of those. So it's a kind of good visual to see, because there's quite a few exams and you kind of end up losing track of what you've done and what you haven't done. Ending remarks, I guess. It's a pretty relaxed environment overall when you get there. I was quite surprised. You will feel nervous, and that is completely normal. Like, everyone is going to feel nervous, but you will also leave enjoying the process, and you'll enjoy the topics that you came across as well. I was really lucky to have had extremely nice examiners for all 6 stations, and also pretty decent topics as well. Hopefully this video does give you a better clarity, a good rundown of what the OSCE day is like. Yeah, I'll repeat this once more. Past topics don't dictate future topics, so bear that in mind. And yeah, I think that's really it for me. Good luck! You'll be fine, guys, and enjoy Christmas and the New Year's. See you guys maybe in the next video, if there is one. Bye. Guys, it's actually been so long that I've forgotten how to even edit videos using the software. But it's okay. I will figure it out. Things I do